Hello again. I'm Dr. J.C. Smith, the Smith Spinal Care Center in wonderful Warner Robins. Today I'm here with a patient, Dave Hazen, who came to me after seeking help at another chiropractic office. And when they kind of plateaued, she was good enough to refer him over for the DRX 9000. So let me introduce you to Dave and have him tell you his experience.
Hi, I'm Dave Hazen, and I started having some trouble with my back and went to my regular chiropractor, and she did all she could do for me. So she actually referred me to a surgeon, and then so I had all the x-rays and MRIs done and all that, and found that I had 2 herniated discs and 2 bulging discs. So they wanted to do a fusion, and we looked at the cost of it, and it was just way out of budget because we didn't have insurance at the time, and it was around $75,000. I could have bought a new house for that, and
a new truck too. Huh?
Yeah. And so my regular chiropractor did tell me about you, telling me that you had this spinal decompression machine. So we came, my wife and I, and all of our x-rays and MRIs and stuff, and y'all did an evaluation and said you could help me without surgery. And I said great, because I'm self-employed and I just cannot afford to take 6 months off of work. So we did the spinal decompression machine on the DRX 9000, and I could hardly walk when we started coming. Within about 2 treatments, I've noticed I could start walking better, and I was starting to stand upright again. And now I'm fully back at work, didn't have to take any time off, and just have a better than life than I had beforehand.
And you do some pretty heavy lifting in your line of work.
Yes, sir. I install restaurant equipment, so it's a lot of heavy lifting. So this machine actually brought my life back to normal, and I recommend it to anyone who's having any kind of back pain or trouble. That's and the staff here is just very, very knowledgeable and very good and comforting. They've eased any fears that I might have had about having this procedure done, and I would highly recommend.
When you went to the surgeon, they told you had 2 herniated and 2 bulging discs?
Yes.
Let me ask you, did they tell you the prognosis, what's the likelihood of success and not?
Well, they told me that they could get me straightened back out and get going again, but 6, 7, 10 years down the road, they would have to do another fusion. And I'm like, well, if it's not going to work, why do it? I mean, if you're going to have another and another and another surgery, it's not worth it.
But the surgeon didn't tell you there was actually a 50% failure rate on back surgeries?
No, they didn't tell me that. They just told me that I would have to have another one down the road. For
another $75,000?
Yes.
It's amazing, isn't it?
Yes, sir. And I just couldn't see myself doing that.
Did the surgeon mention to any practical alternatives to the surgery?
No. Mm-mm.
See, that's another law. That's part of the informed consent.
Mm-hmm.
Is that you have to be told that. And we do it here with everybody. And but I've yet to find a surgeon who actually says, by the way, before I do surgery, the guidelines say you might try classical chiropractor, decompression, all these other things that we do. Now, just for the public's interest, you didn't go to a classic chiropractor, did you? You went to an instrument adjusting chiropractor?
No, I went to a regular chiropractor. She didn't use instruments on me.
She used a drop table, right?
Yeah.
How did you like that?
I liked it pretty well. I thought it worked. I've been going to that particular chiropractor for 12 years now.
Is that right?
Yeah.
Wow.
And her procedures always worked well with me until this happened.
Let me ask you, were you ever given any home spinal exercises to do?
She informed me that I needed to do stretching and things of that nature.
Did you do it?
No.
I know.
Nobody does.
I do. But you're right, most people don't. And I tease them. I said, that's like going to a dentist. He stops your toothache, but you don't brush your teeth afterwards.
I didn't think you could tell.
I call these my prodigal patients. I see them from back attack to back attack to back attack.
Mm-hmm.
But there's no maintenance care, no home exercise care in between. They really don't do the ounces of prevention.
Yeah.
They just go from attack to attack. Hopefully, if you stay on maintenance care, you can hopefully offset some of those bad attacks. But most patients, they don't. And
well, that's what I'm in the process of doing now. I went through my first initial series of the decompressions and got myself back. Well, with y'all's help, got back to a good, healthy life. But now I'm in the maintenance program where I come once or twice a month to make sure everything stays in line.
Have you tried any of the spinal tables, ab lounge, abduor, inversion tables?
Yeah, those help if you do them regularly.
Yeah.
That helps, and
that's the key, is doing it regularly.
Regularly. Yeah.
Yeah. So I say you brush your teeth every day, right?
Sometimes.
I know it. But anyway, good. I'm glad you're doing better. Now the key is to maintain it.
Yes.
Because with your line of work, you could turn the wrong way, twist your spine, and blow it out again.
You never know.
Yeah.
And even if I'd had surgery, I could have done the same thing. But this kept me from having to take time off of work and to get cut on, which takes time to heal when that does.
And that's assuming you're in that 50 percentile that gets some success.
Right.
Because like I said, there's a researcher now, he said that only 5 to 7% of all back pain patients even need surgery. They're suggesting 90% don't, because they can be helped through conservative methods, non-drug, non-surgical. But as I said before, I'm finding that surgeons just aren't telling people that. They tell her, you got a bad disc, that automatically equates to you need surgery, and that's just not true.
Well, that's the line of work they're in. They're trying to keep busy, just like I try to keep busy with my work too. But
it's like that old saying: if your only tool is a hammer, everyone looks like a nail.
Exactly.
That's true. That's where you got a bad disc. But like I say, they're finding bad discs in pain-free people. That's well known. By the time you're 50, there's a 50% chance you're going to have a bad disc. By the time you're 70, there's an 80% chance.
Mm-hmm.
I mean, it's ubiquitous because everybody has back problems from earlier injuries, usually in childhood, that go uncorrected. And by the time I see them at your age, what are you, 39 now?
A little bit above that.
By then, you're going to see the obvious signs of degeneration. It doesn't mean you need surgery, it just means that you've had a problem there. And that paradigm shift really hasn't caught on in the public because only we chiropractors are talking in those terms. And but medics are still out there selling everybody's got a bad disc, everybody needs surgery. And we know it's an epidemic, but the researchers are calling that a widespread misconception, quote unquote. And it is widespread. But that's why we're doing these videos, to try to educate people.
Yeah.
You don't need to jump into a surgery just because you've had a back attack. I don't care how painful it is. You don't need it. There was a case up in Long Island a couple of years ago. A guy that worked on the flight line, he wrenched his back. It wasn't a chronic thing with an old bad disc type of situation. He wrenched his back, went to the ER, and they did immediate back surgery on him. Well, that's uncalled for, unless you've got cancer, fractures, infections. He didn't. He just had a severe back attack. And then he got the bill. This made CBS News. $650,000.
Good gracious.
Yes. And then when they approached the insurance company, said, why did you charge him? He says, well, he had extenuating circumstances, but the reason why they refused to pay was because it wasn't a real emergency. They did it, but he could have done something else, like what we're talking about. Mm-hmm. But they just railroaded him right into a surgery. Can you imagine getting a bill for $650,000?
No.
Yes. Mm-hmm. I mean, that's why I made headline news, CBS. I mean, like you said, the average is $75,000.
Well, that was non-insurance, so yeah.
It's amazing what they get, but nonetheless, that's why we're trying to change that tide, because there are better alternatives.
Yes, they are.
And what we're doing here, it lasts longer. because we're really getting you off that brink of just another back attack. We're trying to stabilize your spine. And that requires home exercises and watching what you do when you lift and bend and twist and all those sort of tips that we teach here. So, well, I'm glad you're doing better.
Me too. Me too. If you've got any kind of back pain of any kind, I would highly recommend coming to Smith Spinal Care to get looked at and get straightened out.
I agree with you.
I reckon you do. Well, that's Smith Spinal Center, not Care.
We do both. All right. Well, thanks a lot, Dave.
All right. Thanks, Doc.